USMLE Prep. Biochemistry-6. Patients with cystic fibrosis characteristically have mucus plugs that disturb the function of which three organs? The pancreas, the lungs, and the liver. Which two pathogens are the most likely to cause recurrent pulmonary infections in a patient with cystic fibrosis? Pseudomonas species and Staphylococcus aureus. Recurrent pulmonary infections in patients with cystic fibrosis result in what pulmonary pathology? Bronchiectasis. An infant with failure to thrive also had meconium ileus as a newborn. What is the most likely diagnosis? Cystic fibrosis. How is cystic fibrosis diagnosed? High concentrations of chloride ions in the sweat. A male patient with cystic fibrosis asks you whether he will be able to have children. What is your response? Unfortunately, males with cystic fibrosis are infertile due to bilateral absence of the vas deferens. A patient with cystic fibrosis is at increased risk for the deficiency of what four vitamins? Vitamins A, D, E, and K, all of which are fat-soluble. What is the most common lethal genetic disease among Caucasians? Cystic fibrosis. Treatment with what drug helps to loosen mucus plugs in patients with cystic fibrosis? N-acetylcysteine. How does N-acetylcysteine free up mucus plugs? It cleaves the disulfide bonds that connect mucus glycoproteins. What is the pattern of inheritance of Fragile X syndrome? X-linked dominant. What is the pattern of inheritance of Duchenne's muscular dystrophy? X-linked recessive.